Hey guys, welcome back to the channel. As promised, here I am again, getting started with some of the latest and greatest in treatments and recovery and all that fun stuff. So let's talk a little bit about what we've got today, and that is Photobiomodulation Therapy, or PBMT. I think we'll stick with that. So what is it? How does it work? And what does the latest research say? Stick around to find out. So what is PBMT? A lot of people would understand that to mean red light therapy, like red lights and therapy. So PBMT has been around for quite a while. You've seen athletes have been using it, doctors have been using it to help people recover from muscle injury, ligament damage, things like that. And it's only fairly recently, in the last 5 or 6 years or so, people have started looking at that towards, or I'm sorry, even longer than that, 10 years or so, people started looking towards maybe using PBMT towards cancer treatment. So first of all, I want to send a shout out to one of our subscribers, LawsDeWest8761, for telling me about PBMT. He's in the UK, where he underwent for throat cancer treatment and used PBMT therapy, and he felt that that definitely helped. And that gave me the idea to look into it and find out, what is PBMT? I'd never heard of it. So as we get into this, what is it? Photobiomodulation Therapy, or PBMT. It's a non-invasive light therapy that uses lasers and LEDs to stimulate cellular processes. It primarily operates within a visible and near infrared spectrum, and while light is absorbed by a key enzyme in our cells, it triggers a series of photochemical reactions. Since this process is non-thermal, it means it doesn't generate heat. Instead, it activates the cytochrome oxidase in our mitochondria. In other words, it makes our cells work more efficiently, leading to benefits like increased ATP production, modulation of reactive oxygen, and enhanced cell survival. Sounds great to me, right? So that's probably how it helps the muscles, the ligaments, getting rid of soreness, recovery, things like that. That's probably how that's helping that. So how does that work with cancer treatment? So while PBMT can show promise, especially in cancer treatments, there have been concerns regarding the application over tumor sites. There was a fear it could promote cancer cell growth. So if we're talking about it helps cancer grow, it helps cell growth, it promotes cell cell activity, that's a reasonable fear. There's a significant commentary and debate that surrounds the available evidence, and that relates to the possibility of potential long-term risk of PBMT in cancer cell mutation, amplification, or escalated relapse rates. When we're talking about using it as a cancer treatment, caution's necessary. So there's a lot of conflicting in vitro data concerning PBMT-induced tumor mutation. So in vitro, remember, is in the petri dish. So when they're doing this, sometimes it seems to work and makes cancer die. Sometimes it does not seem to work and makes cancer replicate, mutate, and do all these nasty things we don't want it to do inside us. So as well as the limited nature of the long-term follow-ups of the clinical evidence. And so what we really don't want is something we think it's working right now, and we turn out 5, 6, 7 years from now, we've actually been increasing our cancer rates because we didn't do enough studies on it. So I'm going to read this straight off the screen. So the review of 2 studies, one in 2016 and one in 2017, showed that the progression-free survival of head and neck oncology patients treated with radiotherapy, chemotherapy increased to the PBM therapy. Nevertheless, until extensive and reliable long-term safety data are available, it should be used with caution when the radiation beam is in direction of the tumor zone. But this effect greatly depended upon various factors like the wavelength of the light used, the duration of the treatment, 5 minutes, 10 minutes, 20 minutes, 2 minutes, whatever, and the specific cell types that were involved. So remember, when you go back to some other videos where we talk about cancer is a very personal disease. What works for me in my treatment may not work for you in your treatment. What works for you may not have worked for me. Another area that's being explored is the use of PBMT with photodynamic therapy. And photodynamic therapy, or PDT, uses photosensitive drugs that are activated by light to target specific tumors. Preliminary research suggests that PBMT could enhance the photodynamic therapy's effectiveness by improving oxygenation in the tumors, making them more susceptible to treatment. So again, this is still all under investigation, because the last thing we want to do is light bomb a tumor and turn it into a mutating and regenerative disease that it's already a mutative and regenerative disease, and we don't want to make it worse. So like I've been saying, is that recent studies are showing a varied result. There was a study that was done that found PBMT could enhance the effectiveness of cisplatin chemotherapy in oral cancer cells. In another study, low-dose NIR laser was able to induce significant apoptosis in the HeLa cells. And just so you know, HeLa cells are the ones that are used in Petri dishes. So again, though, just because it works in a Petri dish doesn't mean it works inside here, right? So other studies have looked at breast and cervical cancer cells, revealing both beneficial and detrimental effects. Really, right now, to me, it seems like it's a roll of the dice. It has to really be done the right way. Some lasers inhibited cancer cell growth, while others promoted it, highlighting the need for very tailored approaches. Clinically, PBMT has been increasingly used to manage the side effects from traditional cancer treatments, such as oral mucositis. And I think we've all talked about oral mucositis and dermatitis. How does it affect our skin? And that mucositis that we get, the inability to swallow, the buildup of mucus and phlegm in our throat, swelling, painful swallowing, dry mouth, all of these things come from mucositis, which is caused by the chemo and radiation therapy. This is encouraging as we look for ways to enhance patient quality of life during treatment. I think we've all who have experienced this have talked about how difficult it is during treatment to swallow, to eat, to drink, become extremely painful sometimes, requiring use of a feeding tube. Until recently, there have been no satisfactory treatment or method of prevention. Basically, it was said that, yeah, you're going to get mucositis. Yes, it's going to be painful to swallow. Yes, it might be painful to talk. You're going to have a phlegm and mucus build up in your throat. Your throat will constrict, and there's not a lot we can do for you on that. You're just going to have to kind of go along with the plan here and take pain medication for the pain and use your stomach tube. However, PBM, a light therapy treatment, was proven safe and effective by the National Institute for Health and Care Excellence in the UK. It's now widely used across the National Health System. Is that right? NHS, National Health System, I think, in the UK, with great results. So, I'll quote this straight off the internet. Jenny Gale, a head and neck clinical nurse at East Suffolk and North Essex NHS Trust, said, "It can really make your mouth sore and it hurts to swallow, which can make eating and drinking difficult, as well as impacting your general well-being." I think we know that. So she added that PBM is completely painless and very simple to carry out. Most patients can do it themselves. Evidence is showing that patients need less pain relief when they've had PBM, and they generally cope with their treatment better. So the breakthrough that allowed, this is a breakthrough that allowed NHS adoption of the PBM treatments due to the development of like the Thor LED lollipop. I'll show in the comments below, I'll list some of this stuff, the links, all this, which patients use by placing it in their mouth for 60 seconds on the tongue, 60 seconds under the tongue. So basically they would use it at the beginning to try to prevent mucositis. They used it prophylactically to prevent the incident and severity of oral mucositis, and therapeutically after mucositis has developed to help reduce the inflammation. Both Christie and Leeds cancer centers found that PBM reduced morphine prescriptions by 63% and 45% respectively. That's pretty good. 63% and 45%, two different medical centers in their audits, and reduced hospital bed stays by 88%. That is pretty good right there. With the variability in these results, it's really important to continue the ongoing research to find out where PBMT protocols for different cancer, clinical situations, where it fits into the whole mold of treatment. And as LED technologies evolve, we can expect new applications in healthcare. So thanks for joining us today. If you found this information helpful, give us a thumbs up, a like, a subscribe, and above all, put your comments down there. Tell me what you think. What do you think about PBMT? Can it change cancer treatment? Or is it going to be one of these who helps just with the side effects? I don't know. Put your thoughts into the comments. And if you have something else you want to hear that you've heard of, you'd like for us to talk about, put that in the comments. Love to hear from you. Have a great day. Talk to you later. See ya.